Yeah, good morning, Gareth, and good morning to your viewers. We had a conference in August, September this year that was focusing on TB, and now TB is a twin of HIV/AIDS. And we then said to ourselves there, we need to build a TB recovery plan as much as we need to also accelerate an HIV recovery plan, because you are correct, we did lose time and focus during COVID-19 when the whole world, all of us were engulfed with the COVID, a new pandemic. Therefore, there were people who were on treatment because of lockdown, probably not accessing our health centers, and there were those that we should have screened and started on treatment, but we delayed and did not because of that. So yes, it did have an impact. So that's why we have taken a resolution that let's actually accelerate what we call TB HIV recovery plans so that we can go back and push as much as we can.
And I imagine today, being the 1st of December, every year is World AIDS Day. This could be one of the most important World AIDS Days since its inception back in the 90s because of the traction lost. So what is the plan today with this recovery plan? What extra effort are you making as a department?
Yeah. Maybe, Gareth, what we need to do is to reflect on the numbers that we do have. For instance, one of the important numbers is that in the country, South Africa, where we think we have done fairly well, we have about 5.1 million South Africans that are currently on treatment. We should go back and track and check how many of those still are on treatment, but there's another 2 million that we need to put on the treatment that we have actually diagnosed prior and during COVID. But however, we also are taking the global view that says let's push our targets of 90-90-90 to 95-95-95, where we are saying out of 100 people who are actually out there HIV positive, at least 95 of them should have known that they are now HIV positive, and then 95 should have, those they must be also be on treatment, and those on treatment should have suppressed their virus. So we are not doing that well as a country, and I'll just give you a figure now. On that, we are sitting at 95, 80, 94, 76, and 92. But the biggest challenge there, if you disaggregate the data, Gareth, me and you, mainly males, are the ones that are not coming forward, and therefore our statistics are pushed down by the males in the country. Of course, this is a species that is not really accessing health as usual, like females. So we are therefore targeting to say, let's go out there, identify those who were on treatment but have since defaulted, and really focus. And me and you must go out and be screened, because otherwise we'll never know the true statistics of the country unless our people come forward and really show that they want to be tested, and then we can start them on treatment. Now treatment is available, and we would have to get our people treated and be fine.
Treatment is one thing, DM, Deputy Minister. I'm sure you're going to agree with me. Treatment is one option, but I suppose prevention really is the message of today as well. You don't want to have to treat people for HIV and AIDS. You want to prevent it happening in the first place. And still, we're sitting annually around 200,000 new infections every single year. Talk to me about education, because in 2022, it beggars belief that these numbers are still so high. Where's the education going wrong, do you think?
Yeah, it's the campaigns. There is something, there's a 10-year-old today who's pregnant and delivering a baby, obviously fell pregnant while she's 9 years. And therefore, we are beginning to see that countrywide and worldwide. Now, when you want to bring such awareness in schools, you are informed, no, you should be a bit careful. You are coming to teach our children sex education, but you are already seeing those issues. So it's another part where we would actually want to strongly want to consider it. But we do have a program, Sexual and Reproductive Health Rights and Services for young people, 15 years up to about 24 years. Those are in high schools and universities. We are really going very massively on those, because there's a majority of South Africans who are not HIV positive as yet, and who are not having sexually transmitted infections as yet in big numbers, but they're at a high risk as compared to our grandmothers to get that. So we need to push and focus and target that population to say, if you want to decrease new infections, new sexually transmitted infections, new HIV infections. Let's focus on this population that is a target population, high schools, out of school, universities. That's where we need to start. We also have fingers pointing at us because some of the young ones said, look, I'm not going to go to the clinic. Last year I went there, asked for sexual and reproductive health services, and they told me I'm too young, 15 years old, go and call your pastor, your mother, your grandmother. Now I can't go there, now I'm pregnant. So we need to actually have the fingers pointing at us who are judgmental healthcare workers to work on our own attitude to say, let's actually say this 15-year-old is so responsible to come to us to say, I am now sexually active, assist me, I don't want to fall pregnant.